Welcome to Munroe Regional Medical Center's nationally recognized and awarded Munroe Heart Program and to our series of introduction videos. This particular video will walk you through the experience of a Munroe Heart surgical patient, from education to our pre-surgical preparation and to the after-surgical care setting itself. From all of our Munroe Heart team, thank you for watching this video on cardiac surgery.
Our education team sees all Munroe Heart patients that have been seen in the surgeon's office and are now scheduled for their surgery. This includes any type of heart surgery, but not surgery related to pacemakers, which are seen by our pre-admissions department. When a patient is scheduled to see us, the surgeon's office sends over a packet of information, which includes your orders, history and physical, tests, cardiac caths, etc., that are pertinent to your surgery. We start by calling you in advance to obtain medical history information to complete our nursing database. We also confirm your appointment date, ask you to bring your advance directives, and all medications that you're taking. Please bring the medications in their container, not just a list. We enter your lab orders, prepare your surgical consents for signing, and your medication worksheet. We fax all lab reports to pathology if you're a lung patient, and prepare all necessary paperwork for anesthesia for their review. All patients are scheduled to arrive at 7:45 a.m. We facilitate your meeting with the anesthesiologist, and at this time they will complete an anesthesia evaluation, provide education related to anesthesia, review the medication list that we have prepared, and provide us with any additional orders and/or instructions on the medications you should take or stop in preparation for surgery. We provide you these instructions in written form in a patient's pre-op booklet. Following meeting with the anesthesiologist, we take you to the lab for your pre-op blood work, obtain a urine specimen, chest x-ray, and electrocardiogram, otherwise known as an EKG. We collect all of your results and reports and give them to the physician surgical team for review. Next, your vital signs are taken, a nasal swab to screen for MRSA is done, additional consents are signed, and the history and physical is updated if necessary. You are then provided with an incentive spirometer and instructed on its use. An incentive spirometer is used to examine the health of your lungs by measuring the filling capacity of your lungs with each breath. It is typically used for people recovering from surgery or with conditions such as chronic obstructive pulmonary disease, also known as COPD, and asthma to exercise their lungs. We review our cardiac or thoracic booklets with you and any family members, which includes instructions on the required pre-op beta-sep showers, your arrival time for surgery, what to expect, and what you need to do to prepare for the day of surgery. Our goal is to ensure all of your questions are answered. After this meeting, we complete all necessary documents and reports. A final customized hard copy chart is made and taken to our 4th floor, where it will be ready for the nurses on the day you are actually admitted for surgery. Any unusual circumstances or anything that needs to be addressed on the day of your admission will be written in red on our checklist and a note placed right inside the cover of the chart. On the day of your surgery, you, along with no more than 2 family members or friends, will be escorted to the pre-op unit to prepare you for surgery. Patients are typically brought to the department by wheelchair. However, if your condition warrants additional monitoring or treatments, you'll be transported via bed or stretcher with all necessary equipment. Upon arrival to the pre-op department, you are placed on a stretcher and vital signs are obtained. For patient safety purposes, you will be interviewed again regarding your identification, surgical procedure verification, allergies, and confirm that you have had nothing to eat or drink after midnight. The pre-op team will then begin to prep you for surgery, which includes body hair removal, insertion of IVs, and administering antibiotics. Sequential compression devices, also known as SCDs, are applied to your legs to prevent blood from pooling in the calf area and to improve venous return. The circulating nurse is the perioperative nurse who will take care of you during your surgical procedure. After the nurse reviews your chart, they will meet and interview you at the bedside prior to being moved to the surgical suite. The surgeon and anesthesiologist will visit and review your chart as well. All personal removable objects, dentures, glasses, etc., are taken off, labeled, and either given to one of your family members or transferred to your room in the cardiovascular intensive care unit. Your 2 family members or friends may sit with you until you are taken to the surgical suite. You will be transported by our anesthesia support personnel to the operating room via stretcher. Your guests are then escorted to the cardiovascular intensive care unit waiting room. Munroe's cardiovascular operating room team consists of registered nurses, certified surgical technicians, paramedic anesthesia assistants, and surgical aides. This group of professionals has a great responsibility to you, the patient. Prior to your arrival, the team will be preparing the surgical suite. The surgical aides will have cleaned the surgical suite and turned on the warming blankets. The temperature in the surgical room will be cool, about 65 degrees. This prevents germs from readily growing. The paramedic anesthesia assistants will be preparing all the anesthetic agents and equipment for the anesthesiologist. They will collaborate with the surgeon and anesthesiologist and formulate a plan of care. The certified surgical technologist will be preparing the surgical instrumentation needed by the surgeon. They create and maintain a sterile field by using aseptic techniques. They ensure these practices are maintained throughout your procedure to minimize wound contamination and reduce your risk for surgical site infection. When the surgical suite is prepared, for your safety, the nurse will verify again who you are and what your specific surgery procedure is. If you are having a procedure that requires a side or specific limb, the nurse will ask to see the doctor's initials on the side or site for verification. At this time, you will be transferred to the surgical suite. Again, we verify who you are and what your procedure is going to be as you enter into the surgical suite. The perioperative registered nurse will be in the surgical suite assisting the surgical technician, surgeon, and anesthesiologist. One of the many perioperative nurses' primary responsibilities is the commitment to promote the health, safety, and well-being of you, the patient, so that you may have a positive patient outcome. We will ask you to move off the stretcher and onto the operating room bed. You will have positioning devices used as necessary. Monitoring equipment such as EKG patches, oxygen finger probe, and possibly additional infusion lines will be inserted. The anesthesiologist may ask you to breathe in some additional oxygen via a face mask prior to the sedation medications being administered through your IV. Once you are asleep, a Foley catheter may be inserted by the nurse if the type of procedure and need is indicated. Then, an antimicrobial agent will be applied on the indicated body area for the type of surgery you are having. The surgical team will then apply the proper sterile draping materials. Before the incision is made, a timeout will be called by the nurse, which ensures that all of the surgical team agrees that we have the correct patient in the correct position, with all of the correct supplies available, and that all of the pre-incision orders have been followed up to this point. Now your surgery begins. Once your surgery is completed, you will be transferred to the cardiovascular intensive care unit for your recovery.